Hi. And we are live here with our recording. Welcome. Everybody, it is my pleasure to introduce my dear friend and colleague, Dr. Dwayne Golbek. So welcome,
Hello.
Dwayne. I'm so happy to have you. And you were so important for this chapter specifically because of all the healer highlights that I want to do, I'm trying to, pick a couple colleagues in that realm. I couldn't have this discussion with anybody else about this chapter except you. So that's why this was so important. Just because you and I had like a very similar upbringing and introduction to muscle testing, which we'll talk about like the different varieties of that and what that means. But just to get us started, like feel free to just please introduce yourself, let us know where you are, what you're doing, and we'll go from there.
Yeah, well, I am Dwayne. I'm a chiropractor as well, and I work in Tulsa, Oklahoma at Integrity, which is where Marina started as well. And so, yeah, we do kind of a big mix of everything here. We do all the normal stuff, adjustments and all that, and then some stuff on the rehab side, and then we do some of the weirder things as well. At least in Oklahoma, our scope is pretty big, so we have a lot of tools we get to use to try and fix people, and so we're pretty open to trying anything.
Yeah, I don't think I realized that because that was our first experience. Both Dwayne and I started practicing in Oklahoma. So now being back at home in New Jersey, I'm seeing limitations of what I had access to doing in Oklahoma. You also similarly took acupuncture training. So we were allowed to, practice that mesh of chiropractic and acupuncture, whereas now in New Jersey, it's a no-no. It's not in our scope here. And so I really have to, I can't unsee the things that we know, the things that we have successfully helped people with in the past, but I have to really like reel back and kind of focus on those foundational skills like chiropractic. And then the accessory stuff, I have to send people out for, which is a really, it's refreshing in some areas, but one of those foundational things that I have to really hone in on my practice now is muscle testing, because it is so within our realm of chiropractic, the idea of, checking someone's body to see if it is neurologically wired correctly, right? So this whole chapter and what I want to talk about today is, if people are not familiar with muscle testing, either, I break it into two branches in the book, but just like why it's so important for your practice, how you talk people into it or out of it sometimes. So I guess we'll just start a little bit with you have such a sports background and you have such a rehab focused background. So can you give me just like how you talk to me like a patient, like how you would explain what you're checking when you are pressing on people's muscles and looking for strength?
Yeah. So basically, and I use it a ton on the first visit the most. A lot of time it's like, I still use it sometimes with certain patients all the time, but every new patient gets some sort of muscle testing. And usually the way that I describe it is I'm going to go through and just make sure the muscles are firing the way that they should, which, maybe isn't the best explanation, but most people have no idea what you're talking about if you go into the science and research and blah, 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 and their eyes glaze over. And so I tell them a lot of times, I go, look, we may find something is weak. It doesn't necessarily mean you need to go do bicep curls or rehab. A lot of times it's some sort of connection that we're missing or that's off. And so we're going to go through and see what's not doing its job as well as the others. And then we're going to use some unconventional methods to make them work better fast. And usually it sticks better than if I just pop you. So.
Right. Yeah. And even just like neurology to people is just this like such a foreign, huge concept. Even chiropractors, like young students that are learning these things in courses, they're like, I don't see where this applies to the treatment table.
Doesn't make sense.
This doesn't make sense. I'm going to memorize it for this test and then totally forget it. So I think you and I were both like really well introduced to how to apply it to like an everyday type of treatment. So before we get too far into it, I'm just going to like backtrack a little bit. Muscle testing and what you are describing is what I would call in this book orthopedic muscle testing, like checking the strength if there's an injury, if the nerves are talking to that muscle. Those are all things that we would do. We would go through your body and isolate one muscle or a group of muscles at a time, press on it, see if it hurts, if it feels good. Where did you learn that the first time? Was that just chiropractic school for you?
Yeah, I think I probably saw it first back when I was in track.
Mm-hmm.
A lot of times it was like, they would just check it if you're like, hey, my hip hurts. They would go through and make sure your hip was, doing what it's supposed to do. Not necessarily, I mean, the treatment obviously looked a lot different than what we do.
Mm-hmm.
But it was something that like almost everyone that works with people or does any sort of manual therapy, they're going to check that.
Right.
It's a really, really common thing to do. It's almost more surprising if someone doesn't check that now, regardless
Mm-hmm.
of how they treat. But yeah, I think probably back in track was the first time I had any experience with it, because it would be like, my hip hurts, and they'd say, the spiel of like, well, your glutes don't fire or whatever it is. So.
Mm-hmm. Yeah, with never really like a true plan, right? Like never a true action plan of
Yeah,
what to do for that besides get
no, it's
stronger.
just like, oh, it doesn't work, so go squat.
Yeah,
Yeah,
yeah. Rest up, like you're off today, or go lift, something
yeah.
along those lines. And so I also played a sport in college, but I had a little bit of a different eye on injuries because I was studying athletic training.
Yeah.
So we really got into the nitty gritty of manual muscle testing is what it's called. And it taught you like very good anatomy. But again, it was like you memorized it, or that was what you just used to show somebody that they were hurt. That was it.
Yeah.
And then you're like, oop, you're hurt, off to an ortho, you have to go get surgery kind of thing, or like rehab. So when I saw that again in chiropractic school, I almost just like, no, I'm not going to use this in practice because
Yeah.
people need to get better with me.
Yeah.
So of course we're looking for those things, same things, injuries, function, activity. Yes. But then you and I very specifically had a new realm of introduction after we graduated into something I call indicator muscle testing. So
Yeah.
you and I were introduced to it as like a ring test or something that would talk to the subconscious body, that the things, firing and living underneath your conscious surface. You don't tell yourself to, you don't tell your lungs to pump. You don't tell your heart to beat. It just happens. So in school, we're not really taught this. Well, I won't speak for you. Were you taught any kind of AK or anything in chiro school?
We had I think I took an AK course,
Mm-hmm.
and we talked about it a little bit, but it was another thing that was just like, I'm never going to use this, so
Right.
let me just pass the test and rub this spot and get my grade, get my C, and be done with it.
Yeah. Yeah. So it wasn't a club for us. And so for listening, if you're not familiar with, the wide variety of chiropractic techniques and things that we have access to training in, applied kinesiology is some people's just true niche. That's all they do, is this type of chiropractic care. For us on the outside, it looks like a mad person walking around a table, touching a muscle, testing its strength, hitting something else. I think I was just so intimidated by those students who were in AK that I was like, I'll never learn this. Like, I can't use this. Do you remember having that like weird thought?
Yeah, and I was pretty close-minded in school, so it was like, well, why would I do that when I could just do soft tissue?
Mm-hmm.
Or it just didn't click.
Yeah, I think, and I was almost intimidated that they had this like privileged knowledge that I did not, or
Yeah,
maybe like
you have that,
how,
like, I don't know enough, so I'm never going to
yeah,
be able to learn all
yeah,
that.
that they
Yeah,
were so ingrained, like they looked like they were in a trance when they were working on people.
yeah.
And I'm sitting over here like, oh, I thought I was pretty smart, or I thought I was pretty good. Man, I must, I'm just going to stick to my
It's
wheelhouse because I do not know what they're doing.
It was a weird mix of this like imposter syndrome, I don't know enough or will never be enough, but also like, well, I'm better than that
Mhm.
type thing too. At the same, it was this weird ego
No,
mix. So
that's a good point. It's like, well, I'm really good at adjusting in rehab, so I probably
yeah,
don't need what they're doing, kind of thing.
and it's like you haven't seen enough people yet, so you're like, well, I fix everything,
Oh,
right?
absolutely.
So,
Yeah.
yeah,
And so why I bring up AK in this book, which I am not trained in applied kinesiology. It's not, my place to teach it.
mhm,
But I think I have met a lot of patients who come in and have been exposed to the
It's
technique.
most people's first experience. Yeah.
Yes, and that's another question I wanted to ask you. When people come in and they say, "Oh, I had this guy," it's always like some weird alternative version of
Yeah.
even us. They're like, "Oh, I had this like crazy doctor who like fixed my, GI distress from muscle testing."
Yeah.
How do you describe like what you think they did, or do you think that's even necessary?
I I do. I don't go super deep into it though. I usually just say like, oh yeah, that's similar. Or,
Hmm.
that's yeah, it's kind of close to what we do. It's a little different, but most people, if they've already had some sort of experience, they're already kind of bought in.
Hmm.
Um, but really too, it's like you start to get a feel of people, I think. And so sometimes I'll go deeper into like, yeah, that's the really cool part of that is blah blah blah, and then they get super nerded out like we do. But then
Hmm.
some people, it literally just is like, yeah, it's similar, but it's a little different, and they're kind of okay with it.
Yeah. And again, we can nerd out so hard on this, but I always try to like reel myself back. Like I am talking to someone who has no idea what we're referring to. Um,
Hmm.
so whereas Dr. Golbek just kind of showed us like a muscle strength test to see on that orthopedic scientific mind, we're looking for those
Yeah,
nerves, muscles, injuries. When you get into more subtle techniques, things like acupuncture, things that focus on that subconscious brain, is your emotions in distress, is your emotional body disconnected, injured, all those things. Like we don't really have quantitative um, opportunities to have those
yeah,
numbers. So those type of providers use what's called indicator muscle testing to ask your body, either usually it's a yes or no kind of question, and they believe with this testing that a strong muscle contraction would be a yes, it would be a collaborative firing of your body saying all systems go, like yes, we want this stimulus, we're strong. Whereas a no answer for an indicator muscle testing, we would go to check a same muscle where maybe a moment ago it was really strong, and then we offered a stimulus or asked a question, and then immediately that muscle group is weak. We would perceive that answer as your body does not like that stimulus. It does not want to move forward in that direction. So, I mean, you can like really get into this kind of stuff. And I think it's so important, like our tact and how we explain it.
hmm
Do you remember like fumbling over your words in the beginning, trying to explain this to
yeah.
people?
Especially like, I mean, I'm in Oklahoma, and so our practice is pretty diverse, but it's like I get like farmers that are
Mhm.
just like, buddy, just pop me and let me go. And so explaining, I think the start is explaining like, hey, I'm looking for a way to keep you from having to see me. If we
Mhm.
do things right, you don't need me anymore unless you get bucked off your horse or something. And I think telling them too, it's like, there's a way to do the weird ethically where it's like, I'm not going to sign you up for 50 visits of, rubbing my hands like this and crossing my fingers and hoping you're better. Um, it's another tool in the toolbox. And when you kind of explain it like that, people seem to be more open to it. So,
Right. Yeah. And it's an accessory. Like
yeah,
it gives
it's a
us a
tool. It's
way.
another tool.
Right. It's another tool. So that level of depth that we think and hope that we're assessing with muscle testing,
Yeah.
um, you have to be in a good headspace for it. Like you
Oh,
can't,
yeah.
yeah, like I don't know if I mean, I'm sure you've recognized, but I hope we can explain a little bit of why maybe certain doctors just cannot go to that depth. Like it's not that, oh, we're
hmm
better and we care more about people that we're doing this type of testing. Why do you think some days, but why do you think other clinicians avoid this type of stuff?
Yeah. I think, well, a part of it is hard that rejection is hard, like you're trying so hard to help someone, and for someone to just be like, nah, I don't buy it. That's hard to sit with. One, other clinicians' opinions of you matter
Mhm.
to a lot of people, and so
Mhm.
there's all these like weird things inside that are like, one, it's hard to trust in the beginning. Um, Two, it's like you have other people's opinions that you're thinking about. Your own ego is taking a hit,
Mhm.
and so that makes it really hard. And a lot of times, like I said, in the beginning, you fix most things, right? And so it's not really until you have that patient that you can't figure out, and like, it keeps you up at night. Like, why can't I fix this person? especially when all the other red flags are clear. It's not someone that you need to punt to a neurologist, right?
Mhm.
It's the normal patient that you should fix that you can't. That's when your ego kind of drops, and you're like, you know what, whatever. I'll try anything as long as it's within my scope and we can do it ethically. So
Yeah, yeah, absolutely. Like you said, like the trust is so important. Maybe
mhm.
when we were both learning this in the beginning, like we had to learn it, right? So we almost had to like
Yeah,
obsess about it, obsess with using and finding a proper way to apply it. And part of that learning process was the conversation of like how to explain to somebody like, hey, I think I have this instinct that this is where we need to go today, but I want you to be involved. So, I'm going to do a couple muscle tests to see if your brain wants me to do this treatment to you. You know, now I
yeah.
know when that's okay conversation to have. But in the beginning, oh my gosh, I think about some people that just like never came back. And I'm like, oh, I hope they found it. I hope they kept trying. I hope they didn't give up on chiropractic.
Yeah, absolutely.
And two, it's also a really great opportunity to educate people of like, hey, this is not chiropractic. Like,
Yeah.
I
Yeah, my
want
first
them
visit,
to
I tell
know.
everyone, I'm like, this is unconventional as far as chiropractors go, right? This is
Hmm.
unconventional as far as everyone goes. But I always tell them, I'm like, look, we do the normal stuff, we do the weird stuff, we do all the things we can to fix you. And I usually make the joke, I'm like, look, it would be different if I was wearing robes and burning incense, turning on the lights and you can get as weird as you want or as normal as you want. I'm a normal guy.
Yeah.
I'll try anything to fix you. I'm pretty vanilla. And so, most people kind of appreciate the like joking about yourself. Like, look, I
Hmm.
know this is weird, okay, but
Yeah.
I'm gonna try to fix you as fast as I can.
Yeah. And I don't know if it speaks to like maybe our background and like in athletics, but
Mhm.
um I would consider myself a pretty like not skeptical person, but I don't
Oh
just
yeah.
take people's advice or like a lot of mentors and trainings we've been to. I'm like, until I have that physical personal experience, then I'm like, oh, something's going on.
I think everything's stupid until it works.
Yep.
If I'm being honest, I'm like, that sounds stupid. And then it works. I'm like, oh, okay, I'll do
That's so perfect for
it.
you. But yeah, so it's like when I say these things to people and like, hey, so that example you used of, something is maybe a joint misalignment, maybe soft
Mhm.
tissue firing issue, something is breaking this connection between your brain and one muscle. We keep using this as an example, but there's, hundreds
Yeah.
of muscles in your body. I use that time to slip in little like bites to see if people are more open-minded. Like, yeah,
Yeah.
the reason your glute's not firing could be a joint that I need to adjust, could be soft tissue we need to fix. It could be like a fear that you're having, that you're really, tense and stressed in that area. And then people are like, oh man, when I'm stressed, this happens and this happens. And then I'm like, okay, good. Like momentum, yes.
Yeah.
Um, I maybe in a specific niche where like the people who do come into our office already have that
Mhm.
awareness that emotions play into physical reaction. Do you really find yourself having to explain that as much anymore, or is this kind of becoming common knowledge?
No, well, I mean, our office is kind of known for it now. And
Hmm.
so a lot of people come in, they already have an idea. Or really, the funniest thing I get is people will come in and I'm like, what have you heard? Like they'll be like, my friend sent me in. And I'm like, okay, what'd they tell you? And they're like, not really much, but they just said like, have an open mind because they're really good. And so most of the time from then, I'm like, okay, cool. So if you already have an open mind, I'll just do what I do. And when
Hmm.
you feel better, then you're not really going to care. Because most people, by the time they get to a chiropractor, they don't care that much anymore, anyways. They just want to feel better.
Yeah.
They've tried their medication, they've tried their surgery, they've tried whatever else it is. They
Hmm.
just want to feel better.
Hmm. Yeah. And I love that about our field that, we find maybe we create a space where people feel like, don't give up, like try
Hmm.
again, explain their story again. And
Yeah.
I think because we are working so intimately with, while we're working on somebody physically, we're having those conversations, trying to pull those aha moments to the surface of, oh wow, my back pain started after I had a fight with my boss, or
Hmm.
this is the anniversary of my mom passing away. Those type of
Yeah.
conversations are just humans talking to humans. So like I
Yeah.
think in the beginning when I thought it was so weird, now it's just like, just be a person, just have these
Exactly.
conversations.
Yeah.
Yeah.
Well, and I think a lot of people, they stumble onto this. They don't even realize what they're doing. You know, like I tell people a lot. I'm like, look, emotion work can look just like me putting my hand on your shoulder and saying, "Hey, you're not broken.
Mhm.
Like you're going to be okay." You know, that's the start. And I think a lot of people are they're just good. They're just good at talking to people, and they get
Mhm.
some of this work done without even realizing what they're doing.
Right.
You know, like caring about someone is already starting things in motion. And
Mhm.
so yeah, it's funny because I think a lot of people are doing work like this accidentally.
Mhm.
And then
Yeah.
now it's just like, well, now we actually have a way to test things or use it, know that we're using this tool or whatever.
Right. Right. Um, I think you just said it exactly there. As we do train and learn new techniques, there's so many overlaps. Like one of the jokes that you and I
Hmm.
always have is everything is everything.
Everything is
Like
everything.
everything is everything. The yoga people are saying the same things as this, and
Yeah.
everything is everything. But like acupuncture specifically, the line along both sides of the spine is considered,
Hmm.
they're muscles to us. Chiropractors are adjusting these long erector spinae. In
Yeah.
acupuncture, those are the kidney meridians and the
Hmm.
bladder lines. And so chiropractors have, unbeknownst, been
Yeah.
affecting the energy within those
You
meridians of
just
people for a
stumble
long
onto
time.
it. Yeah.
Absolutely.
Well, and it's, and
And
I tell people a lot, I say, look, everything we do is a stimulus, and we're just looking for the right stimulus for you. So, you really can accidentally fix things just by happenstance. You just stumble onto this spot and you get the right stimulus there with an adjustment or soft tissue or whatever else. And so having more things to use for a stimulus is going to make you just better and better because you can try
mhm.
different things when the one doesn't work.
Yeah, and that's a rabbit hole because, a stimulus is visual, like having a
Yeah.
patient in the proper lighting, looking at something pleasing versus not pleasing.
Hmm.
A stimulus is temperature, or
Everything.
aggressive or not aggressive that we touch. Yeah, it's like, oop. There's so many different stimuli to properly help somebody. And especially, I think in our unique training, I think one of the most important things we learned was the proper positions to put people in to feel
Hmm.
safe.
Yeah.
Like if someone just had, we'll say like an abdominal surgery, by the time that their scars are, their cuts are healed, they've maybe been cleared
Hmm.
for therapy. We're not having them lay flat on their back that close to the similar position of their surgery. Like their body is just still
Yeah.
naturally in the state of stress that we could be the best doctors in the world, but we're never going to break through that fear barrier. So that's a
Absolutely.
stimulus that I think is probably one of the most important for like understanding proper positions to treat people in.
Hmm.
um I'm glad that you said that word. It just like, I hope that speaks to people so that they understand what we are looking for while
Yeah.
we're doing some of this work. um and it's interesting because I tried to explain a little bit of the science behind some of the stimulus in this
Hmm.
chapter of how do we think we can even talk to the subconscious body? How do we
Yeah.
think that on the surface we are actually tapping into something very deep within the other person? And I've stumbled upon, probably because I have that mindset of, I don't trust you until I can prove this kind of thing. But because for example, we were taught when we started a O-ring test. So one hand
Yeah.
makes a ring, the other hand makes a ring and tries to either break the initial or pull through the initial. So the O-ring test was designed a long time ago by a Japanese cardiologist, actually. And that using a stimulus of the skin. So it's like a lie detector test, which is usually how we describe it to people. We're like, hey, when you get, if you were lying, you could say whatever you want on the surface, but your internal body would know there's this like discord. There would be this like arousal stimulus of, uh-oh. And we catch that quick, spike in either, if someone was measuring the skin, it'd be like increased temperature or increased nervous conduction. For us on the surface, if we were holding a strong muscle, that quick spike is a break. It's like this no. So it definitely takes a special provider to understand like what questions to ask, how
Absolutely.
to apply it to our care. But
That was a learning curve too, I think.
such a learning curve. But I did want to like touch base on like where some of this idea of like a lie detector test comes from. For people who have been introduced to this type of like self muscle testing, that maybe have come into your office, where are some areas in people's life that they do this at home to themselves that you've heard?
Yeah, that's a good question. A lot of people now have, at least in our office, they've sort of heard of it. They've read emotion code. They've done a couple of these things. So they're trying to use it on their own. I think doing it for yourself can be hard for a lot of people, because it's hard to be objective. When you know yourself, it's like, my dad called me stupid today. Oh, I'm angry at my dad. Like, things like that. But I have tons of people that will start to try to use it, especially after we've used it on them. They're like, wow, that really helped. If I can do this on myself, then I can maybe help some of my things on my own when I'm at home. And so that's probably the most that I see.
I try to reel people in, like, hey, use this muscle testing, a yes or a no. Use it for things that you know about. So, you can't really ask. I have like a list of like how to fine tune this and do this at home. You cannot ask questions about the future. You cannot ask anticipation questions. Am I going to get fired? Like those kind of things. Like it has to be something, and most people try to orient it to health. Some like, oh, at the food store, this guy muscle tested for me and told me I need this supplement, that kind of thing. And while I think there's merit in that, it's also way too big of a question. Like you have to have a tiny portal.
I tell people too, because a lot of people, they'll drive themselves crazy. Like people learn something new and they're like, I'm going to use it for everything. What color shirt should I wear today? It's like, you can go either way. You can go crazy with it. So it's like, I tell a lot of people, I'm like, look, try it out, use it with something simple and easy first, and after a while, I think too, like, you don't always need it. You get to a point where you start to just trust the feeling, like, oh, I know I need to look at their ankle. I don't need this or whatever. Like, and I've had docs that weren't into this that explained a clinical intuition where it's like, when you've seen enough of these things, that you need to check their big toe and make sure that it extends well, right? I think it's very similar. I think that is partly you're picking up little subconscious things, and so it's like, I think it's a great tool. But I do think you have to be careful because you'll drive yourself crazy with it.
Yeah, I mean, even just in our own experience, I'll speak for myself, but we had to be crazy in the beginning. Like, I would wake up like in this position. I'm like, like any little discomfort in our body, we assumed that there was something I had to muscle test or something deeper going on. And, I'm glad I had that time because I think I learned a lot of good things, but I don't even use it anymore. So just what you're describing, there is this final point where you realize this was just because I didn't trust my own gut instinct.
Exactly.
Or, this was because the person didn't, maybe I wasn't confidently approaching this person well enough that they would just trust my advice or trust my instinct too. So,
what's funny too, I think, is when I just do things now, like if I'm like, oh, I need to work on this ankle because of the shoulder or whatever, people are more open to that than they are even to this, which is kind of funny because it's like, buddy, why are you looking at my big toe for my hip? And it's like, they just trust that. But then you do this and people are like, whoa, what is that?
Yeah, I really do. I mean, maybe we're just like attracting those type of open-minded patients. I don't know, but I really do find that everybody understands. I try to describe some kinesiology or like, hey, I know your right SI or your sciatic is irritating you, but you could be collapsing on this left ankle. That's why I'm down here. That's putting too much pressure on your SI. So I think that overall, like baseline of knowledge is increasing. We have access.
Well, and word of mouth, like some people too are like, well, someone told me you were an expert on movement, so I just assume you probably saw it when I walked in. It's like,
you're like,
cool.
yes, I did. We'll go with that. And I do use, in the yoga world, fascia is a buzzword, right? Like fascia, which is the lining around groups of muscles. to manual therapists, we understand how interconnected fascia is throughout the entire body. So it kind of just makes sense in our head, but half of that power of how we fix people comes from they understand it. Like they understand why it works. And so we could just intervene. But I think why we work on people, so not permanently, but why our care is more effective, why it is longer lasting, is because we are creating an environment where people understand what we're doing and why it benefits them. So it just like cements in so much more.
Yeah.
That's great. And that was one of the points I wanted to talk about, was like that roller coaster of like using it too much, not using it anymore, you know, explaining it to people. If anybody had any more interest, I heard Dr. Golbek reference the book Emotion Code. The Emotion Code is something that's like, we were just kind of handed in the beginning of this journey. A lot of things like just didn't land with me, or again, I was like, I don't know about that, but it didn't matter. Like you take what you need from all of these different techniques.
And anyone that teaches anything, ego gets involved. And so there's always going to be this weird, like, I took this course and this guy said something kind of weird, but this was gold. You know, I think more people need to have that, like, yeah, but this was gold.
Yeah.
Right. And I'll take that and whatever. So.
Right. And so and this book, The Emotion Code, is about the idea that your body stores, you know, emotions from, you know, good emotions, but mostly it's focused on the negative emotions in this book, which is why I don't really practice it anymore. Why I don't really practice it anymore. But it teaches you how to self-muscle test, and then uses like a chart of what I always call derogatory words to help you understand like why a certain pain could be harboring like almost like a sponge site for your fear, for your anger. And so it's just a great introductory book. Why I do include it in my book and in my chapter is because we are just constantly talking all day to so many people, and what we perceive as like normal knowledge, and everybody knows this, it's very so, you know, humbling to realize, no, that's not the case. So I do love to send people with like, hey, if you want to learn more about this, really recommend you in your own time, you know, figuring out, if you're a reader, here's a book. If you're a podcast person,
I think that one's simple.
Yeah.
You know, it's like, it's an easy read. So that's why that's usually my go-to.
Is there certain things that you like send people, you know, in those directions, or podcasts or anything?
Podcasts, not so much. I don't listen to a ton of podcasts, honestly. That one, The Body Keeps the Score, is one that I'll send some people to. It's a little more dense, and so that's usually more the people that nerd out that I'll send to that one. Those are really my go-tos, honestly, because most people, they just need some, like, they need to skim it, and it gives enough of an idea that they kind of start to figure things out.
Right. Yeah. And I do want to mention, because The Body Keeps the Score is like a very trauma-focused book. This introduction to this world is supposed to be taken in steps. Like it's supposed to be digested, processed. It's not a solo journey. Like there's a reason why we are so thankful that people come to us along their healing journey. It's like, we are not their fix, their healer. We may just initiate that next step for them. With both of these books, when you do finally get into the world of learning that there are stored memories and emotions in your body, you're not doomed. Like, and
I don't send a ton of people to it.
And you don't honestly have to spend thousands of dollars to have someone clear your emotions. Like when you paint, when you sing, when you hug your kids, when you go for a walk, you are naturally, you know, releasing things, and that's why we move. And specifically, Dr. Golbek, movement is so important to both of us, but I did want to ask you to just talk a little bit about like your platform, and maybe one of those reasons that you created the movement cube.
Yeah, well, you know, I think just like any of this, you know, people get, so you do an emotion treatment or whatever you want to call it, right? And then it's like everything is an emotion, right? Or I'm broken or whatever, or I need to come in because I had a bad day. It's like not always, right? Same thing with movement. I think people have been told that they're so fragile. People have been told not to move in certain ways, and once you hurt something, that the highest, indicator of injury, of re-injury, is a previous injury, and all these things, to where people are afraid to do anything. And so I wanted to start at one, because it was like, I wanted to show people what your body was capable of. So a lot of it was like me doing weird movements and saying like, hey, this is okay. But two, it's like, I think it just gives people a little power back in their hand. If you have a movement that you can try and it fixes your problem, like that's pretty cool. You don't have to go spend the thousands of dollars for things.
Right.
But two, I think people get so stuck in certain types of movement. Like, I'm a power lifter or I'm a CrossFitter. And so I wanted to have some sort of outlet to show like, hey, I'm a 30-year-old guy and I'm trying to do the splits. Right? Like, that's okay. But I also like to squat heavy, or, throw weights overhead. So I think it started as, here's a couple exercises my patients can try, and kind of turned into more of a like, hey, it's okay to explore different movements. Right. And you're not gonna kill yourself. Right.
Just getting creative.
It's like one of my favorite memes was, someone said, hey, isn't deadlift really bad for your back? And it was this guy just like this, and it goes, guess I'll die.
Yeah.
It's like, you're allowed to move.
Right. Yeah, I know. I mean, and there's so many limitations to why people are afraid to move. Yes, if they feel pain, or they have this idea that, oh, my dad had back surgery at my age, so I'm doomed if I feel pain. So, with our muscle testing, with our normal treatment, with just being movement people ourselves, like, I think we use ourselves as like health advocates to inspire other people to get intuitive and creative with their play, and like play with movement. That's where all this comes back together. So I love your account. And I hope I'll send some people that way so they can watch some of the things you do. Movement Cube.
Like a Rubik's Cube.
Like Rubik's Cube, yep, is Dr. Golbek's platform there. And, in this world, it's just like I said earlier, it's baby steps. It is getting introduced, having a provider that you trust and care for to help guide you in the process, even when it's guiding you away to the next person who's supposed to help you.
That, like you said, baby steps. I love that, because probably my most used phrase now is, we have to find the right regression for you. The magic is in the regression. Right. And if we can regress things enough to where you won't hurt yourself, but you still get introduced to something new, you're going to see a lot more progress than if you just try that crazy thing you saw on Instagram.
Right. And if you're not familiar, regression is just like, instead of the entire movement, like a full deadlift or a full squat, breaking it into pieces, finding the part of the movement that's the issue. And then workshopping that before you go back to the whole thing. That's awesome. Is there anything else that you feel like we need to overwhelm people with today?
I don't know. I think this is a perfect regression. I think this is
there you go. Exactly. That was it. Well, so happy to have you on. Thank you so much for just, bantering with me, and
absolutely.
All of this information, if you are not a reader, actually one of the things I talk about in this chapter is learning your version of learning, like figuring out how you learn. I can't stand everybody with a book because they don't read. So that's why we do some visual stuff like this, or, auditory, listen to podcasts. But this is all that chapter 3 of The Gift of Healing Hands, learning about the subconscious body, how to talk to it, and maybe finding a provider near you that will, enable you to have a deeper discussion with it. So awesome. Great to see you. Thinking of you all the time. And I can't wait to do another one.
Awesome.
All right, Dwayne, have a great day.
All right, you too. We'll see you guys.